Hi everyone, welcome to another episode of The Good Doctor. Today I'm here with Jon Abrego and we're going to talk about sports injuries. Jon, what is the most common sports injury that you've seen?
Hi, my experience in the clinic with the sports injuries is mainly ACL injuries.
What is ACL for those who don't know?
ACL is the anterior cruciate ligament, which is the main stabilizer of the knee. It's a ligament which is about 4 centimeters long and 1 centimeter wide.
So what does that do? It keeps my knee in place and doesn't allow
It doesn't allow the tibia to go forward and rotation.
Okay, so how do the general public or athletes who are involved in sports, get this kind of a rupture?
The rupture of the anterior cruciate ligament is very common in sports which involves sudden change of directions or accelerations and decelerations. So
like football, basketball,
soccer.
So if an athlete has side-to-side lateral movement and or they need to quickly change direction, that can have an impact on the knee.
Exactly.
And they can rupture it. What is the remedy? What happens after it's ruptured?
The remedy, if it's a total rupture of the ligament, we're talking today, the remedy goes through surgery. They need to replace this ligament.
Okay.
And which they do with a tendon graft that they will take from the patellar tendon.
Okay.
A part of the tendon, and they will use it as a ligament.
Okay. So once you've gone through the operation, how long does it take to recover? What's the procedure after that?
The usual time what we give is about 6 months to return to sports.
Okay.
6 to 9 months, depending of the sports and the injury level.
Okay.
So it's a 6 months process more or less.
What happens during the 6 months?
The post-operatory rehabilitation for the ACL rupture, we can separate it on 5 phases. First phase will be immediate post-op phase, which will go through 2 weeks, and it will be mainly to reduce the swelling of the knee, because this operation is quite heavy, so the knee will be swelling, and we need to have a full extension of the knee for these 2 weeks.
Got it. Okay. So you want to make sure that after the operation, that knee can be a straight, the leg can be straight, and the rehabilitation in phase 1. That would be part of it.
That's the main, this one plus teaching them to walk again.
What's phase 2?
Second stage will be the early rehabilitation phase, which will go from 2nd week post-op to 6 weeks.
Okay.
Okay. On this phase, our goal will be to have good range of motion. Range of motion means flexion. We need to bend this knee to avoid this knee have adhesions. Okay. So by 6 weeks we have to have almost full flexion, which is 130, 140 degrees.
130 to 140. So now in this second phase, you want to make sure that the flexibility is there, is in place.
Exactly.
What's the third phase?
The third phase will be more strengthening phase. We are supposed to have good mobility, almost full, but we will focus more on the strengthening now, right, which we can do more aggressive strengthening. So
Jon, why is this phase so critical? What happens here?
We have to know that the new ligament, from week 6, 7 to week 10, there is a lot of risk of re-injury, because at this time it becomes a bit weak.
Right.
The attachment, they are a bit weaker than in the beginning.
Right. So now we're in the 4th stage. What happens during this phase?
Okay. 4th stage will be from 3rd month till 4th month.
Okay.
Okay. And once the patient is able to run straight line, then we will start doing more changes of direction, changes on the speed.
Right.
And we will install also the jumps, like plyometric exercise. We call jumping. Okay. This is important for the muscle strengthening.
So in the 4th stage, you've got lateral movements, you've got speed, acceleration, deceleration. So Jon, what happens in the 5th and final stage of recovery?
The final stage will be focused on the return to the sports. which the patient was practice. Okay, so for example, for the football, we'll practice more the kicking, the sprinting, and more very specific movements just to this sport.
So you put them in the real environment. They get to get and test the knee in a real environment, whether it's football, basketball, and other sports that's
Exactly.
when they're running. So that is the process of recovery for the knee injury of an athlete. Thanks for watching The Good Doctor on EasyLiving.com, where you can find anything and everything lifestyle.